Hello nurses. Today we will be talking about the pancreas disorder. Diabetes mellitus type 2. But what is diabetes mellitus type 2? Is a systemic metabolic disorder, from defects in insulin secretion by the beta cells in the pancreas and inability of the body cells to use insulin. This results in greater than normal amounts of glucose in the bloodstream. But how does this happen? When we eat a meal, carbohydrates are broken down into glucose and absorbed into bloodstream. This causes an increase in blood glucose levels. When this is high, blood glucose molecules leaves the blood and enter beta cells in the pancreas. This beta cells respond by releasing the hormone insulin. Insulin enters the bloodstream and is transported to cell all over the body and unlocks the cell to allow glucose in. Without insulin, glucose can't reach the cells, causing high blood glucose. In type 2 diabetes there is a decrease in cell responsiveness to insulin referred as insulin resistance. As a result, there is overproduction of insulin early in the disease but eventually decrease due to exhaustion of the beta cells. This results on high levels of blood glucose. By insulin resistance stimulating increase insulin production as a compensatory response, this may predispose the patient to gain weight. About 80% to 90% of patients with type 2 diabetes are overweight at the time of diagnosis. Usually occurs in people that are older than 35 years, and is gradual onset. Mostly new diagnosed patients have had the disease for as long as 10 years without treatment and therefore been at risk for serious complications before diagnosis. Remember, the body is trying for homeostasis. And for this, glucose should be between 70 and 100 milligrams per deciliter. Signs and symptoms: hyperglycemia, hyperhigh, glycglucose, MIA condition, blood glucose level greater than 250 milligrams per deciliter, due to cells' inability to respond to insulin and glucose remains in blood. Polyuria, polymeny, urea urine, excessive urination, due to kidneys trying to get rid of glucose. Polydipsia, polymeny, dipsia thirst, excessive thirst, due to excess water loss from polyuria. Polyphagia, polymeny, phagia hunger, excessive hunger, due to cells are not getting enough glucose to provide energy. Malaise, due to cells are deprived of sugar, there is no energy. Also dehydration from polyuria. Treatment: diet. Medical nutrition therapy for diabetes involves individualized meal plans aimed to achieve the glucose level of 126 milligrams per deciliter or less while ensuring proper growth and body maintenance. Glycemic index: different carbohydrate foods affect the blood glucose level in different ways. Emphasis should be placed not only in the amount of carbohydrates but in the glycemic index of those foods. Quantitative diabetic diet: following a recommended diet, based on kilocalories. 45% to 50% carbohydrates, 10% to 20% protein, no more than 30% fats. Qualitative diabetic diet: stressing moderation when selecting foods and reducing the use of simple carbohydrates, saturated fats, and alcohol. Exercise: when the patient exercises, the muscle use glucose even if insulin is not available. Medications: Lispro, Humalog. Action: promotes cellular uptake of glucose, decreases glucose levels. Clear, rapid-acting insulin. Onset is 15 to 30 minutes. Nursing considerations: give 5 to 15 minutes before meal. Systematically rotate injection sites and to allow 1 inch in between. Oral hypoglycemic agents are compounds and the patient must have some functioning insulin production for oral hypoglycemic to be effective. Metformin, glucophage. Action: reduces the production of glucose by the liver and increase the tissue sensitivity to insulin. Nursing considerations: give with food, don't crush. Monitor for flatulence, anorexia, nausea. Thank you, nurses.
Created using Powtoon.